This is Michael Smith of MedPage Today. I'm in Boston at the annual meeting of the American Association for the Study of Liver Diseases. And with me this morning is Dr. Arun Sanyal. He's president of the society and a professor at Virginia Commonwealth University Medical Center in Richmond. Dr. Sanyal, welcome to MedPage.
Thank you. Good morning.
Dr. Sanyal, there's a renewed sense of optimism at this meeting about a disease which has been a problem for a long time. We're talking about hepatitis C. I'm sure our audience knows pretty much the burden of the disease, but how big is that problem?
Well, approximately 2 to 3 million Americans have hepatitis C, and unfortunately about 80% of these individuals do not know they have the infection. And
it has been difficult in recent years to cure that disease. What sorts of results do you get with, I guess the worst is the genotype 1. What sorts of results do you get with that?
Well, I think we have a renewed sense of optimism because we now finally believe that cure is possible. We have data at this meeting that indicates that actual survival is increased once you can eradicate the virus with sustained virologic responses after treatment. Sustained virologic response is the absence of detectable virus in the blood more than 6 months after the end of treatment.
And results with the current standard of care have not been great, but there are now more drugs available coming down the pipeline, and some very near approval if we're lucky. And they bring the results to the SVR rates to what?
Well, I would differ a little bit. I would say the current rates are good because they're in the 45 to 50% range. However, we can do much better. And with new therapies that are going to be developed in the next year or so, sustained virologic responses of 70 to 80% may be possible.
In other words, in your terms, that would be a cure for 75 to 80% of the people with the disease.
Exactly.
Now, this is in some sense in contradiction. A couple of weeks ago, the head of the CDC, Dr. Thomas Frieden, released a list of so-called winnable diseases. They included things like teen pregnancy and AIDS, and yet hepatitis C, in the face of this data, was not on the list. What was your response to that?
Well, we were disappointed because if there ever was a winnable disease, it's viral hepatitis. The two principal forms of viral hepatitis in the United States are hepatitis B and C. For hepatitis B, we have an outstanding vaccine. And for hepatitis B, we also have now about 6 or 7 fairly effective medications. For hepatitis C now, we have the potential for cure in 70 to 80% of people. So if there ever was a winnable disease, I think this is it.
And there you have it. Optimism here at the meeting. In Boston, I'm Michael Smith, MedPage Today.